One of the things that really touched me is he's a person that is authentic. He told his story authentically. He's a real guy, and he ran a campaign that took place on streets and on porches across the country. It was a local campaign, and it was about people talking to their neighbors and having authentic conversations about what they believe and where they want to take things moving forward. And he inspired people to do that across the country. Some 80% of the people that volunteered had never volunteered before. And I think it was that, the fact that he came from the heart that we've not seen in politics and actually localized it to individual people and their individual stories and what we care about, in our local cities and towns. There's nothing more powerful than the voice and needs of the American citizens, because after all, government is actually supposed to serve the people. A government of the people, by the people, and for the people. So it seems to me that the most important input to Congress is your story.
Yeah, many of you probably remember there was, early in the previous presidency, the vice president had a pacemaker. It actually technically wasn't a pacemaker, but it was pacemaker technology that was installed. Well, within about 6 months of that, my father, he had the exact same brand or whatever of pacemaker installed. Now this pacemaker was kind of experimental because of the nature of the risk that they had. And there was in the news that Vice President Cheney at the time was having this pacemaker removed. He was having it replaced. The idea is that this experimental thing, you couldn't actually just remove the battery. You had to replace the entire thing. Well, my father's was failing around the same time. It was, the battery was going down. I think it was down to like 15% juice. Well, he was retired. He was on, was it Medicare and other things, and they wouldn't approve of the surgery to replace this thing. And so, yeah, it just continued to go down that hill from there, and last November, just a few days before the election, he actually passed away. So, anyway, there's my story.
I managed the claims processing, enrollment, customer service department for a large insurance carrier in Louisville, Kentucky. And as a manager, I would take calls that from enrollees that could not get their issue resolved by the customer service representative. For their example would be a 10-year-old boy that had leukemia and came out of remission, and the last resort was a bone marrow transplant, wanting help for their child. Or parents who were discussing with me that their child was in the hospital, and they were understanding that the 20% deductible of their hospital care, their out-of-pocket expenses for 100,000 plus hospital care. They had no hope of paying. How were they to do that? Knowing that the money that they were going to pay out of their pocket was coming out of their grocery bill. In every conversation that I would have with these parents, not one piece of my training as a manager in the insurance field or any of my discussion was ever about the health and care of these people. How can you get better care for your child? Who can you see? Who can you go to? My training was all about what is your benefit level of your plan and what is going to happen when you don't pay your bill on time. I'm here today because like probably everyone in this room, I want, as what the last speaker said, I want this country to start focusing on a healthcare system that really does focus on health and care and compassion, and not to financial health and profitability of our insurance companies. Thank you.
22 years old. I just graduated from college, undergrad, and August of 2008, I was told that I was taking out my mom and dad's health insurance. This is after that I already said that I was going to take the college insurance that they give you, and I couldn't get back on it because it's over past the deadline. So I'm in the hospital, and I'm giving them my health insurance card, and it's like, well, I'm sorry, we can't see you anymore because we can't see you, you don't have health insurance anymore. So it's like right now, I'm pretty sick. I'm afraid really to have to go to the doctor. Like if I have to go to the doctor, based on my mom and my dad have to pay for it. So it just really kind of hopeless. I want to be in school for a long time, and I don't have any health insurance right now. So
thanks. So my story is last year, suddenly my teenage son was afflicted with a terrible eye infection. He ended up a week in Riley Hospital, and then a month of home nursing care. 4 hours, every 4 hours, IV antibiotics. It was just like he was a baby again. And it really disrupted our life, needless to say. Now, I do have health insurance, and we did take care of our deductible. However, our share of that little episode was $20,000. So needless to say, we're suffering under a huge amount of financial burden. And we cannot meet our deductibles this year, so we simply are not going to the doctors. You know, this is not a good thing. He's fine, he's healthy, thank God. You know, and we're all doing well, but we're being denied, you know, basic services, preventative care, and et cetera. So, you know, I'm really, really hoping, I'm very, very certain that all this will change this year, and that's why we all are here today.
It was going to cost me $300 to $500 for an insurance policy as a single person. And I was really given a choice of going with a $99 policy or a $300 to $500 policy, and I went with a $90-some policy, and it really didn't cover anything, and it took a lot of my time. So it was really kind of like handing over a check and not getting anything for it. And so basically, you know, the cost of a small business is just as important as a larger business because we are the cornerstone of America to try to help recover from the economic damage that's happened. So that's my story.
I have great health care, but my sister, on the other hand, did not. Because of the various jobs that had worked, because of other issues that she has, she'd worked fairly menial jobs. She was considered one of the working poor. She could not get health insurance through the jobs that she had. Even if she could have, she wouldn't have been able to afford it. She had a major cancer operation in 2006. We're still seeing the bills coming in from that. None of them are paid. We're upward $36,000 at this point. And then this year, she had a major stroke. Now she's on top of that, we're adding those. Those are starting to come in now, those bills are coming in. Yes, she's applied for Medicaid. Yes, she's made an effort to do. We, as a family, have had to step back and take care of a lot of things for her because she's literally incapacitated because of her stroke. So we're learning a lot about the system. The system is not very good right now. It's very difficult to get to traverse the system. One of the folks at our table said that we need infrastructure, and I think the young man alluded to that as well. We have to have something done about how healthcare systemically is managed in this country. If we don't do that, we're going to continue to have working poor who cannot get health care, just like my sister. We're going to have even up to people in middle class who won't be able to get health care because of the systemic issues that are not being addressed with our health care. We're seeing the results of that with upwards of $40,000 in bills that have now turned in for my sister who's had these two issues. Works, but can't get health care.
I'm 52 years old, lost 200 pounds, very healthy. But I have, thank you. But I did part of that through gastric bypass surgery. Gastric bypass surgery is an automatic denial with every insurance company in the nation. So when I left the state and COBRA expired, I was unable to get coverage. My husband is also uninsurable. He's a contract teacher, which means he has no benefits available through the school system that he teaches for. And he has various health issues and is considered uninsurable. So we have both of those issues. We've applied for the Healthy Indiana plan, but we no longer have dependents at home, and they have a limited number of spots for those without children. So we're on that list of 6,000 that are waiting for that coverage. So our option is Indiana Comprehensive Health Insurance, which is ICHIA. It's what Indiana calls their high-risk pool. We can get into that. There's a 3-month pre-existing condition waiting period. But the worst problem there is that premiums for him alone are just under $1,200 a month. Premiums for me are right at $1,000 a month. So $2,100 a month, and I'm a self-employed healthcare consultant, don't make a lot of money, and he's a contract teacher, doesn't make a lot of money. So we have both the accessibility and the affordability issue. So it's a problem all the way around. It's a blessing that we have an administration that is ready to address this issue.